My name is Dr. Nagi Barakat. I'm a consultant pediatric neurologist here in UK. I work in a Cromwell Hospital as well as Great Ormond Street Hospital, Portland Hospital. I came to this country 30 years ago and been here since and finished my training and been a consultant for the last 17 years.
When this revolution came, and I said, well, this is, they get rid of the Gaddafi, it's opportunity. I know it is from deep my heart, Gaddafi will go after with this revolution. So I said, well, I think this is an opportunity that what we are dreaming for all these 25 years, that we transfer the knowledge, the skills.
I was called by the Prime Minister, as I call it, and he asked me to become like a Minister of Health. I was very pleased to be asked to do that, and I joined him for nearly a year.
When we got the news that Nagi was going to go to Libya to be the Health Minister, it was in a time of great turmoil. The revolutions all started in 2011. It was something that he'd fought for all his life. He'd campaigned throughout the time that I knew him. He was very passionate about it. He was very passionate for change to the regime, to have a more egalitarian system, one where there were opportunities for people to develop at a personal level, from the point of view of education and business. I think he would have found it very difficult to have gone without our support. He would have been torn, and I really felt it was exceptionally selfish and unfair of me not to let him go. It would have been awful.
There is no military or police in Libya. Tripoli is governed by the militias. But I think over the last nearly 12 months, seems to be the security is getting better and better. Before the Gaddafi departure, we started. There's a group of Libyan doctors, there is a Libyan expat here living in UK, in America, and everywhere. They started this process and they try to go back and deliver and share their knowledge and skill. But unfortunately, it's always there is an obstacle. The health system really is very poor. If you have an operation, suppose an open heart surgery or something like this, if you go to the public hospital, or they will tell you, yes, we will do the operation, but you have to bring from A to Z everything, even medicines, anesthetic, catheters, even your blanket, you have to take it with you. To do a heart surgery, open heart surgery in Libya for a child, it will cost the family between 50 and 70,000 dinar, which no one can afford it. We know that is now the situation in Libya is very bad, because even people, they can't get their salaries. If they get their salaries, they will get it maybe the third of the salaries. So we would like to take these doctors there to do this operation. They will do it for free. The only thing they will be happy to have is their travel and their accommodations. There will be two teams. I think majority of it will be British, some of them from Turkey, some of them from Saudi Arabia, some of them from, I think from other European countries, but the majority of them is from British here in UK. Hopefully, before the end of summer, we will be there in Libya to do assessment, and then hopefully before the end of the year, we will have the first mission. We'll go there and operate on children with congenital heart disease, because there's only one pediatric cardiac surgeon in Libya, and the Libyan population about 6 million. So there's at least 1,000 cases which they are waiting to be operated. These 1,000 cases, some of them a year, months, some of them year old, some of them 2 years, 3 years, and some of them they can't make it to the school because they die. The Training the Trainers program, which I started before the revolutions, and I did it with UCL for about 3 years. I used to take teams with me there, and we spent 3 days delivering course and training the trainers for medicals, because building capacity, training the trainer, it is really very, very important. You can have a good equipment, you can have a good medicine, you can have everything, but if you don't have a good training, how to manage and how to set a standard, how to make a policy, how to follow the policies, this, or to examine, or to write a paper, or to write even a letter, this is all need to be, comes under the building capacity and training the trainers as well.
The initiatives that Nagi is undertaking now are an extension of what he's always been doing. So ever since he qualified He's done lots of programs where he's brought doctors from Libya to get work experience here in the UK. They're called clinical attachments in the medical field. So I've always supported it during the period of Gaddafi, and I will continue to support it now. I think it's very important that when you have the opportunity to get something, excellent training and education from a country such as the United Kingdom, it's really our duty it's the way we pay back. He feels satisfied that he has served his community and as a diaspora member. The team on the other side in Libya have benefited, and at the end of the day that means the population that they serve. So I think it's win-win really.
Probably UK, they don't need me, or they don't need like me here, and I did enough. I think my country need me more.
The scar of the war, the scar of lost someone who is very close to you, or you lost your house, or you lost your job, it cannot be healed. Psychology or the treatment, it is very low in Libya. It's not getting attention at all.
War-wounded people, they are really still in my mind, the fighters. They are really very courageous people who get rid of the Gaddafi. But unfortunately, after the revolution success, everything went pear-shaped.
And I remember when I was in the Minister of Health, the first thing I said, we have to hire as many as I can. I went to Egypt and I signed contract with the Egyptian government to give us at least 25 doctors, because they are Arabic speaker and they helped in this situation. Unfortunately, it didn't happen. People, when they have problems or they feel they have problems, it's always the family come together and helping them, part of the healing process. And I feel it's still needed. A lot of families, they need it. They can't talk about it, but I think when you offer to them, they will really come to you and say, yes, we need it, we want it. I feel that I've got all this experience, and I work as a Minister of Health, and we have a lot of Libyan doctors. So I felt that is a duty that we should pay back and go and do something there. Even we can't safely live there, but we can do something, and that's why I'm doing that.
At the moment, I can't go back to Libya for the last 4 years, and has been threatened many times. If I go back, definitely I will be killed. And that's the case, and hopefully, I'm quite optimistic, Libya one day will be there, and if the chance came again, I will be happy to go and serve. I will not hesitate.
إننا نبالي بل نسير للأمل إن قمة الجبال تستحق لا جرى سوف نبقى هنا